Hey guys, something came onto my timeline today and it was sent with all the best of intentions. My god sister Tara sent me a link to all the discounts that anyone over 50 is eligible for, and I think that's really nice that she did that. She did it out of love. But it got me to thinking, what is it about turning 50 that all of a sudden we are eligible for all these discounts? Why are we at 50 when we should still be healthy and active and working hard and paying taxes? Why are we all of a sudden at age 50 eligible for discounts? And could that be a reason why, with Trump's new healthcare plan, people, when they turn that big 50, are now going to be penalized for simply having a birthday? You know, when I was 48, I started getting advertisements in the mail and cards in the mail saying that I should subscribe to AARP. Lots of discounts available because you're going to be 50 soon. I don't know what kind of discounts. And then you look at the discounts, and yeah, hotels. If my husband and I were travelers and we stayed at a hotel, I could say, "Hey, I'm over 50. Give me a discount." But we don't stay in hotels. If we want to go to a family style restaurant or a buffet or Friendly's or Wendy's or whatever between 2 and 4 p.m. and have our dinner, we might be eligible for a discount. Well, we don't go to those places when we go out to eat. We go to nice, fine dining restaurants. And they don't, I think, have AARP discounts. And we certainly do not eat our main meal of the day between 2 and 4 p.m. We're not in the nursing home quite yet, where that is when your meals are served to you. I'm joking about this, but here's what concerns me. Donald Trump is 70 years old. His health insurance is taken care of now and for the rest of his life, because he's the president, by the taxpayers of America. He is not going to be upcharged because he's 70 like the rest of us will be when we turn 70. He will have his health care taken care of for the rest of his natural life. I just hope that his health insurance that the taxpayers pay for has a really good mental health plan, because I have a feeling Donald Trump's going to need it. But the new health care plan that passed the House last week, make no mistake about it, it punishes anybody who has a birthday, a certain birthday. 50 to 59, your premiums will increase 13%. Now, I already told you guys that I am 52 and a half years old, and that this past year when we got our quotes for my health insurance, I said no thank you, because it was going to be $739 a month with a $7,500 per calendar year deductible just for me. Part of it is because I smoke, and they discriminate against me, even though in the last 30 years I have never had bronchitis. I've never gone to the doctor for an ill visit that has anything to do with anything that they consider smoking related. I am on no prescription medications, and I have not been diagnosed with one chronic illness. I don't have high cholesterol. I don't have high blood pressure. I have nothing wrong with me. In fact, I don't even have a family doctor. I only have an OBGYN that I see every 3 or 4 years whenever I feel like it. Because I think, I haven't had a pap smear for a while, let's go get one, just to make sure. Because nobody more than me would love to have a hysterectomy. Get rid of these reproductive organs I've never needed and should have been gotten rid of years ago. But anyway, that's another show. My point is that when people like the AARP and some of these businesses who are giving discounts, and they are, make no mistake about it, they're senior citizen discounts to people who are 50, you are, in my opinion, and you guys can weigh in on this, giving the government permission to treat 50-year-old people like they are elderly, like we are on our deathbed, and that we deserve to be charged more for health insurance because we're going to cost our health insurance plans more. And that's not the case anymore. It's certainly not the case with the people 20 years younger than myself, who I know personally, who are on Lipitor, and they will take that every day for the rest of their lives. They have high cholesterol. The people much younger than me I know who are morbidly obese and have diabetes and are on insulin and will be for the rest of their lives. The younger people who have, and I'm not going to pronounce this right, ulcerative colitis, and had half their intestines removed at age 29. Well, they already have been told they can't get life insurance the rest of their life because it'll be a pre-existing condition. People with IBS, with endometriosis, who have been diagnosed with HPV, the human papillomavirus, much younger than me. And these people will cost their health insurance companies multiple times more than I have ever cost a health insurance company, because technically I have never cost a health insurance company one fucking dime. I have never, in my entire life, even when I had my ectopic pregnancy, charged my health insurance company more in medical bills than I paid in premiums and deductibles. Never. Not in my entire life. And I'm 52 and a half years old. And now, Donald Trump, who is 70 years old and knows his health insurance is guaranteed, his health care is guaranteed for the rest of his miserable life because he's president. He wants to charge me more, 13% more than the already outrageous price I refuse to pay because I'm 52, almost 53, and when I turn 60, it goes up to 22% more. What is this all about? Why is it that the truly elderly people in our country are being treated so badly? You know, they don't need their AARP discounts. They don't need their free Friendlies sundae and hamburger and whatever between 2 and 4 p.m. They need to be able to afford their prescription medications. And you know what? They should be able to, because that's their money. They paid into it for 50, 40, 50 years. But Social Security and Medicare are not supporting them the way it's supposed to. Instead, their money was taken without their permission and given to able-bodied birther mommies who have a kid every 2 years and expect that to be a disability and the government to support them. Able-bodied mommies living on welfare and food stamps and Medicaid get better health care and better checks every month than our Social Security earning elderly. And it's their money. Drug addicts, who by their very definition break the law by simply breathing our air. We talk about immigrants. A heroin addict has better health care and gets more money from the federal government than the elderly gets on Social Security and Medicare. And they paid into it. It's their money. Is that right? I turned 50 in December of 2014. I felt no different on that day than I did the day before when I was 49. But right away, my gynecologist, have you thought about the colonoscopy? Yeah, I thought about it. I just say no. No thanks. I'm good. You know, we just got a new sofa. I don't want to shit all over it. Not going to do it. The prep is just not something I want to do. It's free. I don't care if it's free. Not doing it. It's all good. I get colon cancer, I'll go home and die. Like a good American. 2015. I had my pap smear, my mammogram, all were normal. I was healthy as a horse. I was 51 years old. I paid more for insurance premiums than they paid for me. They paid for a mammogram and they paid for a pap smear and an HPV test. All were negative. I paid out of pocket for the test to prove I was in menopause. Best day of my life. I'm in menopause. Now I can get rid of all of you. I don't need you anymore. You can't force me to get anything done. You can't force me by threatening me with an unwanted pregnancy like you did for 30 years. You don't get your pap smear, you don't get your birth control. You will let us invade your private body parts. You will let us check you out. Or we're going to make sure you need an abortion. You're going to get pregnant because we're not giving you birth control. Is that right? I was violated on a yearly basis for 30 years simply because I didn't want to become pregnant. And for me personally, I didn't want to have to rely on an abortion. Because in my town, it's hard to get an abortion. There is no place local right here that I could just walk down the street or my husband could drive me for 5 minutes and get an abortion. We would have to travel, get a hotel room. We'd have to leave our area because the Planned Parenthood here in Lancaster does not perform abortions. And I'm sure with all the doctors who refuse to permanently sterilize me, I'm sure I can't find one to get me an abortion in a hospital. That would have been very unlikely. So for 30 years, I was a hostage to birth control, to a prescription drug medication made by a pharmaceutical company that they got money from every time I used it, and to doctors who forced me to have invasive medical testing I did not want, and charged me for the privilege. That was my 30 years. Okay? That's me. This is also me. I don't plan on putting a pink bow on my bald head and walking a marathon for being a breast cancer survivor. I don't plan on going to support groups or speaking out or sitting around in chemotherapy sessions joking and meeting celebrities. I don't plan on doing that. And I'm willing to sign papers saying I won't do that to get affordable health insurance that will cover what I actually might need. Because I'm 50 years old, 52 years old, but I also am very healthy. I don't need prescription drugs. I don't like prescription drugs. I will probably refuse prescription drugs unless I'm dying, and in that case, it won't matter. I'm dying. Here's what I want health insurance for. I have a gallbladder. I only have one. I have an appendix. I only have one. If they need to come out, it would be nice if the insurance company would cover me having those things out if they go bad on it. That would be nice. It would be nice if while I'm out walking my dog or jogging, because I do that, because I'm healthy, or riding my jet ski and I fall and I break my arm or break my ankle, it'd be nice if the health insurance company would cover that. That's all I want. Those things that happen to you maybe once in a lifetime. And of course, the gallbladder and the appendix, they can only happen to you once in a lifetime. That's what I want covered by my health insurance company. Because those things creep up on you. Those things you can't plan for. It's a surprise. I could go to bed tonight and wake up tomorrow with excruciating pain and need my gallbladder out or my appendix out. I could go down the basement right now to get my laundry that's in the dryer and break my ankle. Surprise! That's what I want health insurance for me to cover, me personally. The other shit, the stuff that changes your life to the point where you don't even want to live it anymore, I'm not going to do that shit anyway. I am not going to spend 4 days a week in a hospital with poison coming into my veins. And, look, Jennifer Lopez is showing up. Or, somebody's going to come tell you to add a girl, keep going. Angelina Jolie's coming to tell you that cancer is not a death sentence. Yeah, fuck you. I know what cancer is. I've watched people die of cancer. And I have been fortunate enough to watch both ends of the spectrum. I've watched people die slowly of cancer because they believed in the poison and the cure. And I've watched people die peacefully and quietly of cancer when they refused the poisons and the cure. I choose the peaceful and quiet without the cure. Thank you so much. There is no cure for cancer. Once you get it, you will always have it on the back of your mind. People who have gotten cancer and said they beat it, 10 years later, they get it again. I don't buy into a cure until it's a real cure, which means there's a vaccine that prevents it from being in your body in the first place. So that's how I feel about that. But let's make no mistake about this. If we are going to start basically shuffling people who are an age because of a number, 50, and we're saying when you turn 50, we consider you're already dying. You're old. You're elderly. You're going to start getting sick. And that gives us an excuse to charge you more for health insurance, even though people 20 years younger than you are costing more for their various illnesses because they were young and immortal. They didn't need health insurance. They're 25 years old. Who would think a 25-year-old would be diagnosed with cervical cancer? Who would think a 29-year-old would need half of his intestines removed because of ulcerative colitis? Guess they didn't think. Guess they didn't think. And now, because they didn't think, we're supposed to pay more. Me and my husband and all the other people out there who have no health issues, have not been to a doctor in years, we're supposed to pay outrageous healthcare premiums and deductibles so that these immortal people who never thought they needed health insurance until they did get invited to a table at a restaurant that they can't afford. They're the ones getting the coupons, my friends. They're the ones getting the discount. The sick people on your health insurance plan are paying 20, 25, 30, 50% less than what you're paying for the very same plan as a healthy person. Because we need an incentive to get them on. I used to think that uninsured people did us more harm. And that if they just had health insurance, things would get better. But I was wrong about that. Very wrong. Because it turns out the health insurance companies will punish the healthy people if they are forced to take care of the sick people. And the sick people, believe it or not, even before Obamacare, they were getting health care. They were getting health care. I blamed them, and I think I was right to blame them. They would go to the hospital, they'd say we're uninsured, and the hospital would treat them like they would treat you or me with health insurance. They just wouldn't get paid for it. And then those, of course, the lost wages, the lost income for people who didn't pay their medical bills would end up coming to us because our healthcare costs went up. The cost of a small surgery, the cost of a gallbladder operation went up because somebody else got a gallbladder operation and didn't pay for it. The cost of mammograms have gone up. The cost of pap smears have gone up. Why? Because everybody's entitled to one now, one a year, because of Obamacare. After Obamacare came into fruition, mammograms went from $200 to $600. They're the same mammogram. It's just now the insurance companies are only paying the mammogram providers a small portion. They're only paying the $200. But the mammogram providers have to charge the $600. Or else they won't get anything from the insurance companies. Because technically mammograms are supposed to be free to all of us. I get a mammogram every 3 to 5 years. I can afford the $600 every 5 years. That's fine. But what happens is these people who are getting their mammograms every year because their doctors are telling them they have to have them, or they are sick, they're getting all those free mammograms, and you're paying for them. You're not paying for them because you're getting the same treatment. You're paying for them because your premiums and deductibles are going up to make sure that these people who never thought they needed health insurance before, never thought about getting a mammogram, now they're here. They're at your table. They're at your table in a Michelin 5-star restaurant. And when the check comes, they're going to give it to you because you're going to be paying for it. So it's lovely that when you turn age 50 in America, AARP wants you and all kinds of discounts are available to you. That's great. I would love, as a 52-year-old healthy woman who never goes to a doctor and who doesn't intend to overuse the healthcare environment, I would like to be discounted on my health insurance. I would like to be discounted on what I pay for my cigarettes and my wine, my boxes of wine. So if any of you out there know of a senior citizen discount plan that gives you coupons for the liquor store or the tobacco shop, send me the link. I'll be on board for that one. The other shit I'm not interested in. Just like I'm not interested in most of the health care that this country provides for people who get sick. Because the care, the cures, is actually what kills people. I'm not interested in that. I'm not interested. My mother was killed by medical professionals supposedly trying to help her. I'll go it alone. Thank you very much. Ask Google is really fun when you're in pain or something's going on. Google works. Chemo, not so much. Sorry, this is the way I feel. You know I couldn't end the first season of this show. This is one of the last shows of this season of Political Paula. I couldn't end it without doing something that's going to get me into trouble. But yeah, I don't need a free meal at Friendly's. I don't need a free hotel room. I don't need a discount on my car insurance because guess what? I don't drive. I am actually not even paying full price for car insurance right now because I don't drive. So we got a discount on that because my husband listed me as a very casual, basically I don't drive. So I don't need all these discounts they're offering. I don't need life insurance because my husband has a good career. If I die, his life goes on. In fact, his life gets better because he won't be paying for the wine and the cigarettes anymore. He'll save a lot when I die. Don't give him any ideas. So yeah, I don't need the AARP discounts. I don't want to travel, of course, because of what's going on with our airlines. You can't fly today and not risk getting your face punched in. You want to really need health insurance? You want to get good health insurance? Get it if you're going to go on a plane. Please do. Because you have more of a chance of getting injured just being a passenger on a plane in America today than you do downhill skiing, jumping out of helicopters, rock climbing. There's more of a chance you'll need hospital care and your health insurance if you just simply want to fly from one place to another in America. It's happening every day. So, yeah, maybe we should have special health insurance just if we're on a plane to cover any injuries we may suffer while a passenger on a plane. Scary, isn't it? So yeah, I don't need AARP. I don't need any of these discounts. What I need is fair and affordable health insurance that I can actually use for what I need to use it for. I don't need maternity care. I don't need pediatric dental care. I don't even need dental care because I have my own discount dental plan that we pay extra for. We do that separate. I don't even need that. I need the kind of health care that if I break my leg or I need physical therapy because I broke my ankle, whatever, that's what I need. And until I can get that, and just that, I don't need insurance because what I'm paying for, I'm never going to use. And they make sure of that. They make sure of it. So, that's the show. I'm sure I'm going to get some comments, but remember this. Trump's healthcare plan is an age tax. It is basically, instead of punishing you for how much money you make, it's punishing you for every birthday you are blessed to celebrate. And that isn't right either. It really isn't. And by the way, do you know what is now considered 1%? The 1%? I wanted to ask you guys this. $250,000 a year. If you make $250,000 a year, the government considers you in the 1%. You're up there with Donald Trump. Now, I know I don't make that kind of money. I've never seen that kind of money. But for those of you who do, think about your expenses, your mortgage, the children you're supporting, college education, weddings, the things you need, and plus the fact that you have to also pay for your own retirements and Social Security. At that amount of money a year, they're never going to pay you at 65 to retire and live the lifestyle you're living at $250 a year. Think if you believe you're the 1%, because the government does. They believe that anyone who makes $250,000 or above should be taxed more. Now, see, I disagree with that, and I don't make $250,000 a year. Trust me, we do not make that. But we are penalized for making over $75,000 a year, and I don't think that is appropriate either. I think we need to redefine, first of all, what is elderly in this country, and I don't believe elderly starts at 50. 50 is supposed to be the new 30. And I do not believe that someone making $250,000 should be put in the same tax bracket as Donald Trump. I just don't. Tell me what you think. You guys are out there. I'm not asking you to reveal in public what you earn. But this is 2017, and $250,000 does not go as far as it used to. And I don't think you guys should be considered the 1%. I don't think you should be charged more in your taxes, pay more taxes. And I certainly think you should pay far less taxes than a Warren Buffett. I think you should be included in tax breaks because $250,000 does not go as far as it used to. So let's remember that. That's their threshold. If you make $250,000, they don't care if you have one child, 10 children, if your house mortgage is $3,000, $5,000, they don't care. It's that gross income. Your gross income and your birthday. These are the two things now that the government will use against you when determining whether you are eligible for affordable and accessible health insurance that you can actually use to possibly save your life. Obamacare did fail, and it sucked. But is this really any better? Political Paula, out.